Thank you, Beth, for inviting me to do this, and thank you to Arthur Brooks and everyone here at AEI for allowing this to happen. I told Arthur that I needed this microphone because, like him, I can't do this behind a podium at all. I have to move around. The one thing I want to say before I get started here, we've kind of talked about a little bit today, is I thank you all for being here, all of you, because you're living in a time right now where over 50% of doctors who have children have been advising their children not to go into medicine. And I think that that's misplaced. I think it's wrong. We have a lot of problems in our medical system now. However, they're solvable problems, and I personally am very optimistic about your careers. I'm very optimistic that you're here, and I hope that I am able to impart a little bit to you about why I think you're going to love what you do. I love what I do today still, and I'm closer to the end of it than at the beginning. But I think you're going to love what you do, and that's incredibly important because you're privileged. We're all privileged to have the work that we love that we can actually get paid to do. That's wonderful. So to explain a little bit about that, I have to share with you a little bit about the journey that I took when I was your age and younger to get to where I am today, and why I'm here, standing here talking to you. In high school, my guidance counselor, like you probably have experienced, called us in, and I don't know, around the time when it was time to apply for college, and sat us down and looked at us and said, okay, you have to decide what you're going to do. You've got to decide your path in college. What do you want to be? Well, I didn't know what I wanted to be. I had some ideas. I kind of liked science and math, and I liked art a little bit, and I liked drawing, mechanical drawing. I liked all those things, and they were important. And I thought about maybe engineering, but it wasn't focused. And so my guidance counselor said, well, have you ever thought about architecture? And I hadn't really. So I thought about that for a while, and I picked up the book, The Fountainhead, if you're familiar with Ayn Rand's The Fountainhead. It's about an architect, Howard Roark. And I read the book, and I decided I wanted to be Howard Roark. So, okay, good. Well, I put myself on a path to apply to architecture school, and I was lucky, and I got in. And I was near the end of my first year in architecture school, and I was doing great in math. I was doing great in chemistry. I was doing great in physics. And I was in this design course that was important, and I was spending more hours on that design course than anything else that I did, and I was getting C's. And I was disturbed because there were other people in my class that just seemed to naturally get it, just seemed to flow out of them. So I was out on the front steps of the architecture building in one evening, sitting there thinking, and a senior in architecture, who I had gotten to be kind of friends with, sat down, and we just sat there for a minute, and he said, well, it looks like there's something bothering you. So I told him that story. I said, I just don't get it. I really want to do this. I'm passionate about doing this. And he said, well, this is a really tough profession because it's analytic and art. It's science and emotion. It's all those things mixed, and that's why we only graduate 12 people out of a class of 80 every 5 years, because not everybody can do this. So I kind of knew that where he was going and that he was right. And so he looked at me and he said, you have a big decision to make. He said, you'll finish this because you're determined. You'll get through it. But you'll never be a great architect. And he broke my heart. I mean, literally. I'm sitting there, this was my dream. And he said, you'll never be a great architect. And I knew in here that he was right. I knew that that was the frustration, why I had to spend so much time in my design class and I couldn't do it. So I quit the next day. I had no idea what I was going to do. I just quit the architecture program. And it was the end of the semester, so I went home and I needed a job, so I got a job delivering pizzas. And it was kind of fun. I got to drive a truck. The truck's name was Luigi. I had a CB radio, and I was Luigi, and I could go out and talk, and hey, it's Luigi, delivering pizzas. It was kind of fun. But I didn't really want to be a pizza delivery guy, for the rest of my life. And my mother was a nurse at Toledo Hospital in Toledo, Ohio, and she, of course, picked up that I was frustrated. And she came home one day and said, they have some jobs open at the hospital for the summer, and there's a couple jobs posted on the job board there in the lobby. You probably ought to go check that out. So the next morning I went over and looked at the jobs. And one of the jobs was in the laundry. And I thought, I'd rather deliver pizzas, So the other job was in respiratory therapy. And I kind of knew what these respiratory therapy people did because I'd seen them in the hospital with these little white coats running around with these machines called bird machines, and they gave these breathing treatments. And I thought, well, maybe I can do that for the summer. So it said on the card to go to the 7th floor and apply with the department manager, Terry. So I was leaving the job board, walking to the elevator, and I thought, all right, what am I going to say to Terry when I get there? And it just kind of came to me. I know what I'm going to say to Terry. I'm a pre-med student. I need a summer job. So I got in the elevator and pressed 7, and I'm thinking, okay, I'm a pre-med student. That sounds kind of good. I kind of like that. So I went into Terry's office, and we shook hands, and he said, what's going on? I said, well, I go to college. I just finished my freshman year, and I'm a pre-med student, and I need a summer job. I thought it'd be good to get something in medicine. So he thought for a second, and he got out a pencil, and he wrote a little thing on a piece of paper and handed it to me and said, what is that? I said, it's Boyle's gas law. And he said, you're hired. No kidding. That was the interview. Done. So I said, well, what now? And he said, you come back 7 o'clock Monday morning. Okay. So Monday morning comes, and I'd quit my pizza job and told my parents that I had a job at the hospital. Of course, they were proud. And I came in Monday morning at 7, and Terry looked at me and said, what are you doing here? I said, you told me to come in at Monday morning at 7. He said, no, I thought I said Tuesday. No, you said Monday. So he looked in another room, and there was this guy named John, and he said, John, can you take him to the operating room with you today? And he said, yeah, sure. So John, I didn't know this, respiratory therapy also took care of the perfusionists for cardiac surgery. So John was setting up the pump for their open heart cases that day, and I got to go with them to the operating room. I'd never been in an operating room before, never saw an operation. So we got down there, and he showed me how to change. We changed into scrubs, and we're in this little off room from the cardiac surgery rooms, and John's setting up the pump and explaining to me, how to do this, and the surgeon sticks his head in the room and says, hi, who are you? And I said, oh, hi, I'm Dick Armstrong. I'm a pre-med student. I'm here for the summer. And he said, well, that's great. And he looked at John and said, hey, do you have anything? Do you need him? Is there anything he needs to do? And John said, no. And he said, how'd you like to scrub with me? And I said, sure, that'd be great. So he showed me how to scrub and told me, we went in the room, and the patient was asleep and draped, and he said, I want you to stand right next to me, just put your hands down like this on the patient, and you just watch the operation, and I don't get in my way, just stand there. Well, he's doing a mitral valve replacement. And so within minutes, he makes an incision in the sternum, picks up a saw, cuts the sternum open, opens the pericardium, and for the first time in my life, I'm looking at the beating, living human heart, and I was in absolute awe. I had never seen anything in my life so unbelievable. And not only that, he went ahead and put this man on bypass, stopped his heart, opened his atrium, cut out the old diseased valve, put in a prosthetic valve, filled the heart back with blood, took the air out, closed everything, started the heart up again, took him off bypass, and fixed this guy. And I decided, I still remember it to this day, that was the epiphany. I'm going to be a heart surgeon. I made up my mind. That's it. And I went home and told my parents that night, I made up my mind. I'm going to be a cardiac surgeon. And they kind of looked at me in horror because I knew what they were thinking, dollar signs. Whoa, where's that going to go? But that's okay. So I went back to school, and I did become a pre-med student and was lucky enough to get accepted to Ohio State's medical school, and then on to residency in the Navy. And the Navy residency was great. We got to operate a lot, and I still had dreams to become a heart surgeon. And I was in my early part of my chief residence year, and I had been accepted into 2 cardiac surgery fellowships, and I was working with a vascular surgeon, a great guy who ended up being the chief of vascular surgery at Brigham and Women's in Boston. And he was a really nice guy, a super guy, a great mentor. And one day in the hall outside of his office, he said, "Hey, Dick, can I talk to you for a few minutes?" And I thought, okay, what did I do? The boss wants to talk to me. So we went in, sat down, and he said, "I know you've been accepted to this cardiac surgery fellowship, but I have to tell you something. You shouldn't be a heart surgeon." And again, I was thinking about sitting on the steps, outside of the architecture building, thinking, okay, this guy's going to destroy my dreams again. And he said 2 reasons. He said, first, cardiac surgery is boring. They do the same operation every day, all day. That's a time when they were doing coronary artery bypasses all the time, and they hate it. And I thought, okay, well, that might be true, but that's not a good enough reason. But then he said the next reason, and I think he was right about this, I hope. He said, and the other reason is you're not an asshole. And I said, well, what does that mean? He said, but you'll be an asshole if you're a heart surgeon. And so, I thought about that a little bit, and then I got on the phone and I called my other mentor, cardiac surgery mentor, Carl Chrysler over in Norfolk, and said, this is what Andy told me yesterday. And he said, well, the Bethesda program's not doing so well right now, and the Navy's not going to let you go back to Ohio State, so why don't you just go do general surgery for 3 years, and if you still want to be a cardiac surgeon after that, give me a call and we'll see what we can do. So that's what I did, and I am not a heart surgeon. That story I tell just to get to the point of why we love what we do, and I do still love what I do, but I want to share with you some experiences about that, but I want to say one thing about this path you're on. When you graduate from medical school, when you put those letters DO or MD behind your name and you take that oath, you will become a different person for the rest of your life. It's the truth. People will value you. They will look up to you. They will look at you as wiser than them, and they will depend upon you. And this goes directly to what Arthur Brooks just said. They will need you, and it will give your life value, tremendous value. But it will be a bumpy road. It will be difficult. But that's okay. The difficulty is worth it. So I want to tell you just a few stories about some patients that I cared for over the years, some a while ago and some more recently, that illustrate this and illustrate it, I think, deeply. Jack was a guy about 68 years old who was kind of short and a little bit rotund. He had kind of a big beer belly, and I met him early one morning in the emergency room in a hospital where I had a private practice. And he was there because his wife had called the ambulance because he had the worst back pain and abdominal pain that he'd ever had in his life. And I kind of knew what he had when I walked into the emergency room, but he was awake and his blood pressure was about 90 and his wife and daughter were there. And we got a quick ultrasound and he had a ruptured abdominal aortic aneurysm. So we put the gears in motion. We had a protocol there where we just moved quickly through the emergency room and do the resuscitation in the operating room. And I told Jack and his wife that he had, because he had a blood pressure and he was still talking to me, that statistically he had about a 50-50 chance of making it through this operation. And the goal is just plumbing. The goal is to stop the bleeding and fix the plumbing. So how you do that is you go to the operating room and you don't put the patient to sleep until you're ready to cut. The anesthesiologist tells you it's time to cut, and you make an incision from xiphoid to pubis. And within 2 minutes of making that incision, you need to have a clamp on the aorta at the diaphragm to shut off all that blood flow and allow blood flow to the upper body so they can resuscitate you. So that's what I did. And then you have about 5 to 8 minutes to figure out what's going on with the aneurysm and get a clamp below the renal arteries so the kidneys don't die. And that's what I did. And we used a tube graft and sewed that in, and there's a lot of detail to that. But we fixed Jack's aneurysm in about 2.5 hours and then took him to the ICU. And he was a little confused for a couple days because it's kind of tough on your brain when you're 68 years old and you're in shock and you have all these things happening. But he recovered, and on about the 8th day, we were able to discharge him from the hospital and went home. And then at about 2 weeks, I saw him back in my office for his follow-up visit. He had this big line of staples that we needed to take out. And his wife was with him in the office, and when I walked into the room, he kind of had a little grin on his face, and his wife was an artist. And he couldn't wait to pull his shirt up. And I didn't quite know what was going on. But when he pulled his shirt up, his wife, in this beautiful calligraphy, had written on his belly, his big rotund belly, "Thank you, Dr. Armstrong." I could have cried. I took his staples out. If it had been today and I had my iPhone, I would have taken a picture of his belly, because that would have been really, really good. But that is just one little vignette of why we do this, why all of you will be doing this. There's a lot of reasons we do this, but that thank you and his wife's art on Jack's belly was the culmination of why we do this. A couple years later, I met a couple, Carol and Tom. They were coming back. They were in their late 30s, and they were coming back from a vacation in Hawaii. And they had to fly overnight to get back, and they landed at an airport about 70 miles south of our hospital, and so they were tired, and they had to drive to home where we lived. And so Carol was in the passenger seat. They were driving a big sedan, I think it was a Mercury Marquis, something like that, and Carol fell asleep, and then Jack fell asleep, or not Jack, Tom fell asleep, and they ran into a parked garbage truck at full speed, about 70 miles an hour, to the back of a parked garbage truck. And they both survived, and EMS brought them to our hospital. The driver, Tom, had some long bone fractures and some lacerations. He wasn't really doing badly, but the ED doctor called me down to see Carol because he was very confused about what was going on. He'd never seen anything like this in his life. So I went down there, and Carol was still awake, was hypotensive, pale, and I pulled the sheet back to look at her abdomen just to begin the exam after I'd introduced myself. And she was absolutely pale from just below her rib cage down and had no sensation and no pulses. So I'm thinking about 70 miles an hour. You go from 70 miles an hour to stop. She has some type of deceleration injury, and the x-ray tech happened to be there, and I said, could you take a quick cross-table lateral of her thoracic spine? So they did that. Put up the film. Her spine above was here, and below at about T8 to T9 was here, separated by that much. So she had transected her spinal cord, her spine, and probably her aorta at that level. And that was not repairable by anybody. And she was still awake. So I went into the room where her husband was and showed him the x-ray and told him what was going on. I said, I can't fix this. I said, I don't think anybody's going to be able to fix this. But he said, can you take me to her? And I said, that's why I came in here. So we took his cart and put it next to hers, and I explained to Carol that she had an injury that I could not repair, that was lethal. I said, what would you like me to do? And she said, could we just be alone? So I pulled the curtains and left them alone. And it took about 15 minutes for Carol to become unconscious. And she died right there with her husband, with her. And they got to spend their time, that last 15 minutes together. And I was there with them making that decision because of what we do. Because we are trusted to care for people every day. And all those decisions are not easy. The things that we decide are not easy, but the people we care for need us and trust us to make those decisions. And the decision we had to make was, are we going to do some type of crash, ridiculous operation here in the next few minutes that's going to take Carol away from her husband in the last moments of her life? Or are we going to let them be together to share the value and the love that they have for the last few minutes that she'll be alive forever? And so we made that decision. True story. So the last one's better. Esther, it was an 82-year-old lady I saw not long ago in my office. Gorgeous, lithe, delicate lady with blonde and gray hair, flowing hair, and crystal blue eyes. It was sent to me by one of our family physicians for a little thing on her upper lip that they were concerned might be a cancer. So I see a lot of those people now. And I walked in the room and I introduced myself. Hi, I'm Dr. Armstrong. I understand Dr. Gill's worried about that little thing on your lip. And I'm looking at her lip and I'm thinking, I can hardly see anything on her lip. And she said, well, 2 weeks ago I saw Dr. Gill and it looked a lot worse then, but I'm not really that worried about it now. In fact, I was gonna cancel the appointment, but I thought I better come anyway. And I could tell, you can tell when there's something going on with somebody and they're maybe hesitant to say it, but you can just kind of tell. And so I just kind of sat down next to her and waited a couple seconds, and she looked at me and she said, my husband died 3 months ago. So I sat there and I said, how long were you married? And she said, 47 years. I said, did you have any children? She said, no, we never had any children. We had a lot of nieces and nephews, and we got a lot of joy out of them, but he was my best friend. And she started to cry. So I asked her a couple other questions, and we just sat together in the examination room for about 15 minutes while she told me about, he was a teacher and had retired, and he really loved teaching, and told me stories about their travels and how they did all these things together in their life and enjoyed each other. And then she said, and I haven't been able to talk about this since his death. I haven't been able to tell anybody how I feel until today, right now. And she looked relieved. And she stood up and she kind of got a little bit of a smile on her face, and we hugged. And I said, well, if you have a problem with your lip, and she said, forget my lip. She said, I just needed to talk to you. And I didn't quite know how to do it, but we did it, and thank you so much. And if there's something that goes on with my lip, I'll find you again. I'll come back. I know where your office is. Notice that in all of this, we talk all morning about the economics of healthcare, how we get paid. But I honestly, for my entire career, I don't do this to get paid. I do this, or I should say, I get paid because I do this. And that's a gift. And so I wish for all of you a career in medicine that you absolutely love, that gets you out of bed every morning, and that because you love your career, you provide excellent care to your patients, and you're never distracted from their needs. And if you do that, you will get paid in droves because they do need you, and you'll feel it every day, all the time. And don't let all the noise that's going on right now in healthcare and how we get paid distract you from that goal. That's incredible, and that's what you all need to do, I hope, and that's what I wish for you. Bless you all for picking this profession. You did the right thing. Don't let the naysayers get you down, okay? Any questions? I think we have a couple minutes. I don't know what you're going to ask me about that.
Does anyone know where the microphones are?
There's one up here.
Okay. Perfect.
Oh, okay.
Well, that was a great speech. I asked you one question.
Like I said, it's not the kind of speech that lends itself to questions. You kind of just sit there, like, what? But no, seriously, if you have any questions about some of the things I talked about, I'd be happy to answer them.
Okay, well, they're not going to ask you. I'm
Okay.
going to ask you.
Oh, no, we got a question right here.
We got a question.
Okay.
Sit down, Beth.
That was pretty inspirational. Have you ever managed to convince any of your colleagues who are a little bit more cynical about the state of medicine to kind of turn around and start appreciating their jobs again?
We're working. Yes, we're working on that. We're working on that. That's one of the aspirational goals of the Doctors for Patient Care Foundation and United Physicians and Surgeons of America working together, and the Benjamin Rush Institute. I mean, we're working on that. The message is here. The message Arthur gave you about fighting for people and working for these principles is the same message. It's just translated into the world of medicine, what we do. Other questions?
Yeah, well, I was just gonna say, so, use the mic then.
That's right.
So now we know why you're a doctor. Why are you, and we know how much you love being a doctor. And you also got to have a chance this weekend to talk to him about these incredible stories that, I mean, he's not just a doctor, he's a fantastic surgeon that has done amazing things that people say, you did that surgery up in your little hospital? What are you doing there? Why aren't you in some big major center as some bigwig guy? Well, it's because he loves his community, he loves what he's doing, he loves his family, and he's finding a way to balance it. And in spite of that, he is spending hours working with BRI, with Doctors for Patient Care, with United Physicians and Surgeons. Why?
Because of all of you. Honestly, because I want you to have the same experience in your careers that I have. And I see the problems with the way healthcare has gone in America, and I would hopefully like to be a part of that repair that needs to happen. And as we talked at the Keystone meeting, the unity that we need to have, we need to get over the anger. Everybody's really angry. And I think it was good that Arthur talked about what contempt looks like. You know, there are a lot of people in our medical profession who have contempt for the Affordable Care Act and now the new MACRA law. And, you know, you have to kind of see some of the things from the other side. And one of the things that I needed to do is what Arthur Brooks did when he went to poverty and experienced it. If you read his book, you'll see that. Well, I decided in 2009 I need to go to Washington and experience it and figure out what the heck is going on there. And it was helpful. We learned a lot. And then I needed to go to the Heritage Foundation. And the first time I heard Bob Moffett, who's a health policy expert at Heritage, talk, I asked him a question, one question, and I don't think you were there that day. You might have been there that day. I said, what do you think is wrong? If you could say in one sentence what's wrong in American healthcare, is he said this from the economic point of view. The doctor and the patient don't have any idea how much they're spending on anything. The economics are completely opaque for both sides. That's my one sentence answer, and I kind of got a little tear in my eye because I thought the same thing. And afterwards, I went up to Bob and shook his hand and said, hey, can we be friends? And we actually turned out to get to be friends, and I've had debates with him. He's been my debate partner, and the Heritage Foundation has been a great resource like AEI is now. But I guess what I would say to you is if you want to help move things forward, you're already here. You're already part of this leadership to help, but you need to be like Danny McCory, who wrote a paper that helped us pass legislation in the state of Michigan to allow direct primary care practices to flourish and grow. You need to learn, like Meg Edison has learned, how to work with the legislature and your state medical societies so that you can make these changes that need to happen. And then we need to learn how to communicate with not only our colleagues, but our public, our legislators, so that the conversation opens up and they're willing to listen. We've learned a lot about that over the last few years. Beth and I have learned and studied a lot about how to communicate with people who don't like your message. And it's very, very important that you do those things. So the reason I'm here is I'm interested in all those things. It really makes me have a purpose for my life, And I'm excited. I think we can do this. I really honestly believe that we can do this together, all of us together.